Hey there, fellow COVID warriors. Dr. Peterson here with Regions EMS for today's COVID briefing. Today is Monday, May 18th, 2020. Information that I'll present is current as of today. We make no guarantees it'll be current tomorrow, so stay in touch with our website, regionsems.com. Click on the COVID-19 link, and you'll see a whole page full of resources that we keep up to date with the latest information that you need to know about COVID-19. So first of all, happy EMS week to everyone out there. It's kind of awkward this year. Usually we have some sort of a barbecue or media event at Regions Hospital to celebrate all of you and the work that you're doing, but obviously a little tricky to do with the social distancing restrictions and standards that are in place right now. So we have produced a little tribute video that's up on our websites and that your leaders should have received via email today. So feel free to check that out and thank you for all that you do. Let's go to some numbers here. Worldwide, as of today, 4.7 million cases that have been confirmed, with about 317,000 deaths linked to COVID-19. In the USA, it's grown quite a bit since we last talked. 1.5 million cases here in the United States, with about 89,000 confirmed deaths. Number continues to rise. In Minnesota, we've reached the 16,000 case mark, and we have 731 confirmed deaths related to COVID-19. And in Wisconsin, 12,000 confirmed cases with 459 confirmed deaths. Numbers are still climbing. It's still been a linear increase, so not sure, what the future holds, what the next few weeks holds, but we'll talk about some of the modeling predictions here in a few minutes. Also a reminder again that the ECMO team is available, open for business. Several of your agencies have sent patients to the ECMO team, some with some very good results. So keep them in mind as a resource. If your first rhythm is shockable, call the number that you see on your screen right now, get the ECMO doc on the line, talk it over, and get moving as quickly as you can. We want to keep these on-scene times under 15 minutes whenever possible for the ECMO eligible patients. All right, what are we seeing right now? I don't have any new significant management updates, but let's just talk about kind of the status of where we're at. We've kind of hit a steady state. A lot of the planning is done. We're just sitting back and waiting for the cases to show up. Hopefully they don't, but we are ready in case they do. One thing I would encourage you is don't become lax with your PPE practices. Wear a mask at all times, even around the station. I know it's getting old, it's getting very inconvenient, but that's the single best thing that you can do to protect yourself, protect others. And by protect yourself, I don't mean wearing a mask protects yourself, but by wearing a mask, if you do get exposed to someone who is infected with COVID-19, your level of exposure decreases to the point where it's unlikely that you will need to be quarantined for any length of time. So very important to continue to wear masks just to protect your agency, our workforce. You don't want to be the one who has to take a 2-week vacation and have others backfill for you. So just again, stay vigilant, keep up your PPE practices with patients in the station and out in the community too when you're off duty. We have seen some activity at some of the local care facilities, nursing homes, assisted living facilities, so we're keeping a very close eye on that. It's likely in the coming days or weeks that one of your agencies will experience a call to a care facility requesting that multiple residents be transported. Please keep us in the loop on that. We want to know about that. MRCC can be your resource to activate our medical direction involvement in real time with that to help sort out some of these situations. The goal is to not transport anyone who does not need to go to the hospital. Sometimes there will be people who need to go to the hospital, and sometimes that will be our only option. But we would like to keep these people on site or distribute them to other care facilities whenever possible. And that's something that we might be able to assist with if you find yourself in such a situation. The modeling now, and I apologize to those of you from Wisconsin. I'm going to include you in the Minnesota modeling estimates because western Wisconsin, right on the river, pretty much is part of the Minnesota metro area model as opposed to the Wisconsin modeling, which would really be the eastern edge of Wisconsin, Milwaukee, Madison area. So The Minnesota model has been updated, and some of you may have seen this in the last few weeks with some of the governor's press briefings. Currently, since the stay-at-home order has expired and now we are in more of a soft open for our economy and our society, if you see the graphs on the screen here, they're comparing the Plan 1 or the Scenario 1, which would be if we did absolutely nothing, an unmitigated, rampant run of house of COVID-19. Scenario 5 would be what I figure that we're in right now, which is where we have a stay-at-home until May 18th. And then Scenario 6 would extend the stay-at-home order until May 31st. And you'll see that there's not a huge difference between Scenario 6 and Scenario 5. However, where we are at, if we play out this Scenario 5 based on the latest modeling, our peak hospitalization, our peak infectious time is predicted to be June 29th. So we still have about 6 weeks before we would truly hit our peak. That's quite a ways to go. I know that we haven't been necessarily overwhelmed by anything yet, but just keep that in mind. We haven't seen the worst yet here in our area. We as the frontline workers here, you in EMS out in the community, myself doing kind of a combination of things, but also in the hospital, in the front lines, in the ER, we are the ones that can limit the spread by modeling what we are asking other people to do. So just be prepared now as we are reopening things. Wisconsin is, opening a little bit more with the restaurants and bars than Minnesota is, at least for the next few weeks. But I think it's fair to assume we can expect some sort of a bump, a little bit of a second wave here in the coming days or weeks as people are out more in the community, exposing each other, and then give it that incubation period, which is about 7 to 10 days or so. I think next week we may see a little spike in cases related to the opening of society. And then from then on, too, we'll just have to wait and see what happens. But that's coming, so stay vigilant. We can't get lax on anything here. The final thing I want to talk about is you have probably heard about this on the news, this MIS-C disease, so multi-inflammatory syndrome in children. It's this, I guess it's a new thing that health providers are seeing it's really coming out of New York City right now, but we're seeing it everywhere. It's a new syndrome that we're seeing in kids who have either been exposed or infected to COVID-19. And it involves a fever, some significant systemic involvement that is affecting at least 2 organ systems. A lot of times there's a lot of GI symptoms, a lot of skin involvement, so some significant rash and dermatologic issues. And the respiratory things are kind of secondary with this, but this is causing kids to be critically ill, admitted to an ICU requiring critical care services, and there have been deaths reported. This syndrome has been reported in Europe, been reported in New York City just because of the overwhelming number of cases that they've seen. Haven't seen much here in Minnesota yet, but it is something to keep on your radar. Just because a kid has a fever and you think they have COVID does not mean they have multi-inflammatory syndrome. This is something separate from COVID-19. There is just a link to kids that have been infected. The actual COVID-19 infection tends to be less severe in kids, as we've kind of known from the information that's available. But then there's this secondary risk for developing multi-inflammatory syndrome. Unfortunately, there's not much that we can do from a treatment standpoint. Antibiotics aren't necessarily helpful. All we can do is support the organ systems that are affected. So if it's GI symptoms, vomiting, diarrhea, usually those kids need rehydration, IV fluids, electrolyte replacement. If it's lung involvement or respiratory, obviously they may need some oxygen or some respiratory support. The rash, if it gets really bad, we treat it like a burn. We protect the skin as best we can. But just be aware of this. Pass on your concerns if you think that there's 2 or more organ systems involved to the hospital, because it is reportable right now to the Department of Health, as they're keeping a very close eye on this. It does have some similarities to another very rare disease called Kawasaki syndrome that's a syndrome, a disease in children of unknown cause that causes some skin changes, some multi-system involvement, hand and feet swelling, joint involvement, as well as the big concern is heart problems. It can lead to some coronary artery issues that can lead to some long-term heart issues in kids. Just to be clear that this multi-system inflammatory syndrome is a completely separate disease process from Kawasaki syndrome. So even though the two are somewhat linked or related, they are completely separate disease processes. So there's information available on the CDC website on MISC. You can read many news and media reports, some of which may be true, some of which may not be true. Again, this is something that is new that we are just beginning to learn about. But just keep an eye out for some really sick kids, and just consider the fact that they may have either currently infected with COVID-19 or been infected in the recent past. So obviously use very aggressive PPE precautions and pass on your concerns to the hospital. All right, let's go back to our trivia question from a week ago, which was, which type of surface can coronavirus particles survive on the longest? We had a number of guesses for this question. Lee Smith from Lakeview Hospital guessed stainless steel. Stu Glazer, Chief Glazer from Stillwater Fire, also guessed stainless steel. We had Bill Boyd from Scandia Fire, glass was his answer. Mike Hines from Scandia Fire, stainless steel. Cindy from Northland Ambulance guessed wood. Jessica Johnson from Cottage Grove, stainless steel, that seems to be the theme. Gail Knutson from Marine Fire and Rescue, glass. And Brian Mueller from Washington County Sheriff guessed glass. And then just today, a late entry from Josh Tweed from St. Paul Fire went with stainless steel. The answer I was looking for was glass. Between the 5 options, copper, cardboard, stainless steel, wood, and glass, it's interesting that these coronaviruses don't survive as well on surfaces that are porous, such as cardboard, fabric, that kind of thing. They do much better on surfaces that are completely smooth. And of those, glass would be the smoothest surface. So the source that I found said that estimates up to 5 days on glass surfaces, and much less on the other surfaces. You can find information on the internet that may support your answer. That's fine. Call me out if you want. I'm going with the best available evidence that I have, which says glass. But this just highlights the fact that this is a novel virus. We don't know a lot about it yet still. This is just what we're learning. So thanks to all of you that participated. It's just fun to get those responses in and kind of see where different people are paying attention from, watching these videos. And again, any requests for information, questions you might have, topics you'd like to see covered, send them to regionsems@healthpartners.com. For today's trivia question is, how many different coronaviruses are known to infect humans? We know that there's multiple strains of the different types of coronaviruses, but if you look at the actual types of coronaviruses, how many of those are known to infect humans? Submit your best guess to regionsems@healthpartners.com. Again, check out our EMS Week 2020 tribute video on our website at regionsems.com. Follow us on Facebook, Regions EMS, or YouTube, Regions Hospital EMS. Other than that, thanks for all you guys do. I know this is kind of a week that we're going to try to do what we can to celebrate you and your accomplishments. You're going to see stuff posted on other EMS websites, ems1.com, naemsp.org, the NREMT and the NAEMT websites, some of the fire, law enforcement, public safety websites. But tribute that we put together, best that we're going to be able to do since we can't all gather together for a celebration. We'll hopefully be able to do a little bit more later this summer once things relax a little bit more. But again, thank you for all the work, the long hours, the risks that you put yourself in front of for me and my family, for my community, for the Twin Cities, for Western Wisconsin. All of the work that you do, whether it's thankless work, tiresome work, dangerous work, just monotonous, repetitive, seemingly low acuity. You are there for when we need you. And thankfully that's rare, but when we do need you, we appreciate your skills and what you do for our communities. So thank you. Happy EMS Week. We'll see you next time.